now we're excited to have Molina present for us today. Molina's been a partner of ours for quite a long time. They're really a fantastic health plan, and we're looking forward to hearing about their changes in the marketplace for 2023. So I am now going to turn it over to Amy and Andrea to present on Molina. Thank you.
Thank you so much, Steve. Appreciate you guys for having us here. And I know you've had quite a morning, so thank you for hanging with us as we close out the day. I know you got a couple more days coming, so we'll try and keep this as exciting as possible and save some time for questions at the end. My name is Amy DeMarco. I'm our Director of Sales for our Western region. We're tag teaming the presentation today. So Andrea Espinosa, who covers our California market, is going to kick us off, and then she'll hand the baton to me, and I will take it away for our national vantage point. So Andrea, please get us started here. Thanks, guys.
Oh yeah, thank you, Amy. Yeah, good morning, everybody, or good afternoon. It is a pleasure being with you today. Thank you so much for your time. I know you guys are super busy. I always say this, but I can't believe it's open enrollment time again. It just feels like it never ends. But very exciting updates that we have. So again, thank you so much for your time. And just wanted to really quickly share my contact information in the next slide. And please feel free to reach out to me if you have any questions, nothing too big or too small, any kind of issues that you might be having. Even if I don't know the answer, I'll make sure to connect you to the right person and get any issues that you might have resolved. So I would love to connect with you guys. So don't be shy and reach out. And next, we always like to start off with a little bit about Molina. So our mission is to provide quality healthcare to people receiving government assistance. And our vision is to distinguish ourselves as the low-cost, most effective, and reliable health plan delivering government assistance-sponsored care. So our top values are integrity always, absolute accountability, supportive teamwork, honest and open communication, and member and community-focused care. So really important for us. And, I can tell you from working with Molina for these past 2 years, I really love our team. We really work together to support all of our states, all of our broker partners. So again, any other partners that I can connect you with, reps that I can connect, would be more than happy to do that. But really love our team, and we do some really great teamwork. And so a little bit more about Molina. So why Molina? So we offer 24/7 nurse advice line, 24/7 teledoc virtual care services, annual wellness exams, preventive prescription drugs, preventive screenings for children and adults, pediatric vision services, pediatric dental services, and then my favorite, the My Health Perks Wellness Program, which comes with a $50 incentive, and I'll be talking a little bit more about that in the next slides. And then next we have our Molina provider online directory. Love this too. So this provider directory is available for our Molina Marketplace website members. It is easy to access. You can access it directly by going on molina.sapphire365.com. As you can see here, information is clear, easy to locate. You can easily filter your search to find what you're looking for. You can see right away if a provider is accepting new patients. You can also click on View Profile for more information. Once you select a preferred provider or it is located, you can self-select the PCP via this provider directory or by using your Molina, My Molina account. So we do give folks various ways of being able to select their preferred PCP. And then on the next slide, we'll take a closer look at our PCP selection options. So again, members can select the PCP by logging on to their provider online directory, My Molina portal, or the Molina mobile app. So if members need personal assistance, they can always contact our member services department, or you can contact me if you're having any issues, you want to locate a provider, if there's something you're not seeing, you're not sure if they're in network, always feel free to reach out to me and I can take a look. And then next we have our My Molina app. So My Molina is the Molina member portal and mobile app. It is easy to navigate, secure. Members have access to their digital member ID cards, premium payments, medical records, PCP changes, everything a member needs in one place. Let's say a member loses their member ID card, they can log on to My Molina via the browser by downloading the My Molina app, and they can access their member ID card. They can also send it to the doctor's office, print it, or pull it up at the doctor's office. And the app is available for Android and Apple, so easy, convenient. And this is something that we always promote. Make sure that your members create a My Molina account so that they have access to everything that they need. And then next we have the My Health Perks program. This launched this year, and it's a new wellness program for our marketplace states. This program is available to Molina marketplace members and their dependents 18 years or older. So through this wellness program, we hope to continue to engage members in interactive programs to manage asthma, heart disease, depression, diabetes, among other prevalent issues. So Molina will offer incentives to members that participate in this program. This includes an annual $50 financial incentive for completing a combination of the wellness assessment and the annual routine physical exam. And we're looking at preliminary reports, and we notice that maybe people are completing the physical exam, but then not the wellness assessment. So definitely letting your members know to please complete both so that they do take advantage of that $50 financial incentive. They must complete both. And members can sign up through their My Molina account. And again, if you have any questions about how the program works, how to sign up, you can always reach out to us. Be more than happy to talk a little bit more about that. And then next, we do offer a variety of payment options to make life a little bit easier for our members. So members can make a one-time payment, no account necessary, through our Bill Matrix portal. And I added the link here. They can also submit payments by phone, by mail, by MoneyGram, or by creating a My Molina account. And of course, our recommended option, auto pay, so that members have peace of mind that they are up to date with their premiums. So all of the ways are listed there. And then next we have our My Molina website, our marketplace website. So we made some key enhancements to our Molina marketplace website. We integrated a Covered California calculator, frequently asked questions to update members, any key concerns. We have that section for them, easy to toggle between 2022 and 2023 plan and benefit information. Members and brokers can access payment options, My Molina, formulary, forms, plan documents, everything all in one place. So we always like to promote our molinamarketplace.com site. Very easy to access. And again, most of the information that members and brokers need can be found here. If you have any questions about our site or how to navigate it or how to locate any information, again, please feel free to reach out and I can help with that. And then next we have our Molina Marketplace broker portal. And that's, again, available through molinamarketplace.com. And this is a great site. So it gives you access to the broker book of business along with other broker support tools. You can log in using your Molina agent code and password. And if you need any assistance or have questions, please feel free to reach out to us. We can give you a little bit of a tour of how it works. How can you download your book of business, how to access that, navigate the different options on the broker portal. Any questions that you might have, we can give you a view of that. And then I think I will hand it over to Amy.
Fantastic. Thank you, Andrea. Appreciate that. So we'll jump into kind of our national view now and then into our where we sell in throughout the United States for our ACA plans, and we'll get into product design and all that fun stuff. But at the start here, did just want to, reiterate our ever shifting OEP timelines here. So for all of our healthcare.gov exchanges, Washington, Health Plan Finder, Connect, and Be Well will be on one calendar this year, November 1st through the 15th of January. If any of you guys are selling in Idaho or California, we have, slightly different open enrollment dates there. So just want to highlight that, we'll have kind of early start for Your Health Idaho, October 15th, and then they will run through December 15th. So all enrollments for that OEP will be starting 1/1/2023. And then covered California always likes to be different as well. So November 1st through January 31st. And that January 31st enrollment, even if it's, midnight January 31st, they will have a 2/1 effective start date. So all 1/1 and 2/1 effective start dates there in California. And renewal starting a little bit later this year because there was some game time decisions around funding for enhanced CSRs in California that didn't go through. You will have all the ARP subsidies there, but that did push back renewals opening a little bit. So looking at October 18th for active renewals, and then all new business will start November 1st. And a couple other exciting things happening nationally. I'm sure other folks have touched on these, but do just want to reiterate, some amazing strides that have been made this year. So the family glitch getting fixed. This has been an issue since the ACA law went into effect, since it was written back in 2010. Basically that meant the family glitch meant that if a employee did receive affordable health insurance, 5% of their income, that was considered affordable for the whole family, even if the whole family wasn't getting sponsored by the employer at that level. So the employee could be, considered having an affordable plan, and then the rest of the family was playing the full boat and they weren't eligible for subsidies. So that left a lot of people, without affordable health insurance available to them. Many of these folks are still enrolled through the employer plans, but it's 4.3 million out of the estimated 5.1 million that fall into this family glitch. But they could most likely get much more affordable health insurance on the exchange. And then it's estimated that a little shy of 500,000 are remaining uninsured in this bucket. So pretty good opportunity to transition these folks over to a subsidized ACA plan. About 2.5 million of those folks reside in our state. So you can see the breakdown here where it's estimated. Pretty good chunk in California, Texas, having the highest number there, then followed by Florida, Illinois, Michigan, and down from there. And they estimate that about 900,000 to 1.2 million will enroll on the exchange in 2023. So a new opportunity for folks to get subsidized coverage this year in all states. And I'm sure you guys are well aware, this was a nail biter, figuring out if we would get the extended American Rescue Plan subsidies. And luckily they were extended for another 3 years. So everyone who's enrolled, on a highly subsidized plan will remain so for the foreseeable future until 2025 plan year. And then fingers crossed we get that, maybe extended again or, built into the law. So we have a little reprieve for another few years, and then we'll see what comes of it after that. But 2023, keeping the same subsidy levels that we had in 2022. All right, national footprint, not a ton of changes for us here at Molina. This is a kind of another rebuilding year for us. We are focusing on all the foundations of running a health plan, making our provider contracts as strong and efficient as possible. Making sure our claims processing is functioning in a timely fashion and in compliance with all of our regulatory requirements, and just improving all of our internal processes. As you guys have seen, as Andrea hit on, we have revamped our member portal, our provider portal, our provider online directory, all the kind of external facing things we invested in last year. And this year we are highly investing in internal processes, and we brought on new team members to assist us with, a large swath of the business of running a health plan. So very excited to see the strides being taken here at Molina. Not seeing that pay off in 2023 just yet. We are, not expanding to any new states, but excited about 2024 and maybe some state expansions there. So stay tuned. We will be adding 2 counties, though, not to bury the lead here, in Michigan, so Lake and Genesee, and just one withdrawal here, not a largely populated county in Ohio, but we will be removing that one. But otherwise, for the most part, staying pretty status quo in our other states. So I won't, go too much into detail here. We're in Southern California for California, pretty spread out throughout Florida. We will continue to have our kind of tiered product in Broward and Miami-Dade County. I'll get into that in a minute. And Idaho, this was a new state for us last year, so we are continuing in our kind of tri-county footprint in each corner of the state, but really going to be competitive in Bingham, Bonneville, and Bannock this year. Illinois, sitting in the same footprint, really focusing on the Chicago metro area. And Kentucky, really staying in the same spot, as you can see, but this is the most highly populated part of Kentucky. So we're focusing on the large population centers and then kind of build out from there. The gray in each one of these maps is our Medicaid footprint. And the way Molina typically rolls out a plan is we get a Medicaid contract, we build those relationships with providers, get everyone contracted, and then slowly build out our other product lines. So as you can see, Kentucky, we've got the Passport Health Plan relationship there in all counties. And, if that is any indication, you might be seeing some expansion in certain areas of those states where we have a Medicaid footprint. Mississippi, we are already everywhere here. I think we expanded it to all counties last year, so nowhere else for us to go. Same thing with New Mexico. We do need to offer our plans in all counties. So we have been in all counties in New Mexico since day one. South Carolina, almost every county, but you can see we have a Medicaid footprint there. So potential to be statewide in South Carolina in the near future. Texas, we are, again, targeting those major metro areas. So DFW, Houston down in Harris, moved into Bexar County in San Antonio last year, and El Paso up in the corner, and then down along the border, southern border with Mexico, Webb, Rio Grande Valley, Star, Hidalgo, Cameron. And Washington, no major changes here. There was a potential to offer the public option plan, but we did not move forward with that opportunity this year. So we are sticking with our Molina design plans and our Cascade design plans. It's all jumped into at a later date, but you can see we're here highly focused on the Seattle area and added some southern counties last year, as well as over on the east side of the state with Spokane. In Wisconsin, for whatever reason, we only like the east side of Wisconsin. So you can see we're in those states, obviously, probably because we have our Medicaid contract there and built out from there. And there's a couple remaining Medicaid counties there, but otherwise we are full on in eastern Wisconsin. Utah, north and south, Salt Lake and the surrounding regions there up at the top, and then a couple of the slightly more rural areas down south. And that's it for our product placement. So next I will jump into pricing. As I mentioned earlier, foreshadowed our bit of a rebuilding year again for Molina. We are being a little less bullish about the market this year. I think we were concerned that the ARC subsidies might be going away, and trying to price for that. And, when the ARC subsidies were reintroduced, we stayed with our pricing for better for worse. And it does look like we came in a little bit higher than most of our state averages here, with a couple states in the exception, those being Illinois and Michigan. But you can kind of see where the thought process was behind some of these increases. We have double digit 11% in California, but we are still remaining pretty much on par with where we were last year. So very competitive in West LA County, San Bernardino, and Riverside counties. I think we're still number one. Might have swapped to the second place, but by a few bucks in San Diego County and Imperial County. We are still very much the price low cost leader there. Florida, we are still kind of waiting to see where the market will fall. A lot of the biggest options there were not readily available in the public filing. So we only kind of know where about a third of the market was coming in at price wise. So Florida is still a bit of a unknown for us, but we are trying to be competitive there. That's one of the places we have a bronze plan, as I'll jump into in a minute. But we're hoping, and a tiered plan, as I alluded to earlier. So Florida trying to, stay competitive, get competitive on both our silver and bronze there. Idaho, they're reintroducing or introducing a reinsurance program in Idaho. So everyone was pretty competitive with their rates this year, not a lot of increases. So that kind of drove prices down for the most part. So we're excited to see that. We remain about flat. So we're not as competitive as we'd like to be in some of those western regions, but the east side of the state, we are looking good. Illinois, we are coming in under the state average, but we were a little bit higher than most of the folks last year. So I don't think it got us to the most competitive place, but we are moving in the right direction there. Kentucky, we're about on par with the state average. Folks were able, and most of these states were able to file and then refile. So we saw some rate decreases after the fact. So I think we're looking pretty good in Kentucky with their initial rate filing. And then unfortunately, once everyone gets a peek at what everyone else is doing, they can get a little more creative. So probably not in the lowest cost spot in Kentucky, but about on par with the rest of the state. Michigan, we are doing good there. Not picking up as much ground as we would like. Some other folks are making some competitive moves as well, but I'm happy to see that we were below the state average there. New Mexico, doing some interesting plan design changes, as I will get into in the next few slides. They are doing highly subsidized plans for FPLs, lower FPLs, so 100 to 300, moving folks onto these highly subsidized and high AV plans, so 99%, 96%, and so on. So a bit of a change, year of change for New Mexico. So I think everyone was a little more cautious about what that might mean. There is, I think, another kind of CSR portion of this where we have to do some repayments. That's new, and we haven't done any state. So trying to build out some runway so we can get that done and make sure we are successful in New Mexico with their new state-based exchange. It was a bit of an interesting year this last year. If you guys write in New Mexico, we're hoping for smoother sailing next year. Ohio, came in a little higher than average here, kind of right sizing our rates for some contracts that we have there. We're hoping that we'll still be competitive in a couple of the major markets, not all 3 Cs, but hoping Cleveland and Cincinnati will be in the game there. Mississippi, we are higher than the state average, not by too much. So hoping we can kind of maintain some footing there. And South Carolina, the average was higher than we thought it was going to be. We filed a higher, 12%, which is not ideal, but I think the rest of the market was kind of following suit. So we're pretty much in the game there. My next 2 states, Texas and Utah, 2 of my states, very, with the heavy heart. I want to be transparent. We're admitting that we are, again, right sizing the ship for some contracts in Texas and Utah and some other headwinds, especially in Texas. Regulatory costs incurred. So it's been, we were building in Texas last year, and now we are continuing to kind of make sure we are shoring up our foundation there and plan to return to growth in 2024. So Texas, the market average came in at double digits. We came in a little bit higher than that. So we have a couple, counties more in the southern part of Texas, that southern border where we are looking better, but, not super competitive in our major metro areas there this year. Utah, what can I say? I'm being truly honest with you guys. Utah, unfortunately, making some right sizing decisions there. Washington, we came in a little bit above the state average. We are still hoping to be competitive. We were pretty price competitive last year. So similar to California, it's just getting us a little more in line with the competition there. and Wisconsin, a slightly higher increase here than the state average. But I don't think it's putting us too far out of the market there. We have another competitor who, for the first time ever, filed a rate increase. So, folks are moving in that direction a little bit. All right, jumping into silver plans. We took the guidance of the NBPP this year and, kind of streamline our plan design, moving away from, kind of the proliferation of different deductibles and copays and focusing on having just a few strong plans in the market. So you can see our silver 2, 4, and 7 plans. Those will all be migrating over to silver 1. So that membership will not be left hanging. They will be migrated over to that silver 1 plan. That does have a vision option. If they are on the vision plan, they will continue on that, or they can, add on the vision plan come OEP. We are required to have a Texas standard plan, silver 3, so we'll continue to have that. And then we are offering, as required by CMS, the silver 8. So that is the CMS mandated plan design that you'll be seeing there with those higher deductibles and out-of-pockets. Florida, our silver 5, that was our tiered plan last year. We are moving that to our silver 9 plan this year. So same plan, just kind of different numbering there, but still focused in Broward and Miami-Dade in Florida. And then in Kentucky and Idaho, we are rolling out a silver 11 on those state-based exchanges. So this is an eye chart, and I promise we'll get you guys our benefits at a glance guides, which we pulled these from, as well as our state fact sheets, which will go into all the hospitals in those states, as well as the benefit highlights and value adds for each of those markets. So stay tuned for those. I'm not jumping into provider network here to keep us on time here. I know we got another 15 minutes, but our marketplace sales managers will be happy to touch base with you on any particular markets and the nuances in those regions. So silver 1, you can see our CSR plans, as well as the silver 1 250, which will be available to all income levels above 250 and above. And all these plans do have an adult vision option. We are, moving away outside of that silver 100 from a 0 deductible plan. We are, needing to make sure that our plans are, effective for our members, but also are driving, folks to care when they need it. We saw a pretty massive influx of folks after COVID who were coming in for a lot of care that they may have put off or was elective, and we had some unfortunate risk adjustment in a few of our states that was driving up costs for us. So we are getting back to a little more even keel here with some deductibles, but you can see all the services that are available to the members before that deductible. So you have, your urgent care at the same price as your primary care, emergency room, specialty care, mental health, and let's see, for most of our plans, then all of our plans, labs, and for our tier 1 and tier 2 drugs, all available pre-deductible. And our silver 8. So as I mentioned, this is our mandated silver plan that we are required to offer. So higher deductibles and some copays, as well as co-insurances for outpatient services and most emergency room facilities there. And silver 11, this is in Kentucky and Idaho. So kind of similar there. This is our version of the silver 8 for our state-based exchange states. So pretty similar look and feel to that silver 8 plan. And silver 3, another standardized plan that we are required to offer in Texas. So if you're familiar with those benefit designs, this is on par with what we are required to do in Texas. And last but not least, our silver 9 plan. Again, this is for Florida. It is our tiered network plan, so a little more competitive with some of these costs, and really focused on Miami-Dade and Broward, slightly slimmer network there. Gold plans, obviously a smaller offering than we've seen on the silver side, focusing on our gold one and the mandated gold 8 plan. We are transitioning all of our gold 3 plans in Texas, not very many. We'll be moving those to our silver 3 plan just for Texas. Gold 1, gold 8, you can see here. Our gold 1 plan is a Molina design plan, and then the gold 8 for the mandated plan. And again, you guys will be getting this deck, so I don't, don't furiously write this down. We'll also be sending out the benefits at a glance that have all this information detailed. Bronze 1, move into a bronze 4 plan here. So our bronze 4 is going to be our bronze plan for Florida and Mississippi, as well as the standardized bronze plan that we are required to offer. These are 2 FFM states where we have bronze plans, and we are required to offer them in Washington and California as well. So you'll see on the Washington and California slides where our bronze plans sit there. This is just for FFM states and the breakdown here. And going into Washington, we are keeping our Choice Care Silver, so that's the Molina design plan there, and then shifting our bronze and gold to the Wabi Cascade standard plans. So keeping our Molina silver plan there, but then the rest of that membership will be migrated, crosswalked over to the Cascade design plans. And this is the Molina design plan. So you can see here, this is our silver 1. Excited to be able to see that $0 deductible there still in Washington, as well as most of the services, available without a deductible, pre-deductible. Except for the medical deductible, you can see some of those tier 3 and tier 4 drugs are available at a 50% or 40% after the deductible. And the Cascade standard plans, again, these are set by the Washington Health Benefit Exchange or Washington Health Plan Finder, and these are mandated for all carriers to offer. So we are just going to be focusing on those plans for bronze and gold. Let's see, and silver, obviously. And then here's our bronze and gold for the Cascade plans. And then we're hitting New Mexico. So as I alluded to earlier, New Mexico is getting very creative and all for the benefit of their members. We were very excited about that. But this basically means they will not be selling a quote unquote, silver 100 or silver 150 plan. Those folks will be automatically enrolled in a turquoise 1 or turquoise 2 plan. And the title here is the turquoise 1 or with extra savings, turquoise 2 with extra savings. Similar shifting for the 200 to 300% of the federal poverty level. So those folks will move to a gold from a gold 1 plan to the turquoise 3 plan with extra savings. So they're basically, what they would have otherwise been on a silver plan, but they are moved to this turquoise 3 and turquoise 4, which is basically a gold plan with those enhanced cost saving benefits. We will be offering a gold 1 plan for folks who are not eligible for these FPL tiers, as well as our silver 1 in that market. So you can see here, we are not marketing, silver 100, silver 150, and everything else is laid out here. The turquoise 1 with extra savings, turquoise 2, turquoise 3, turquoise 4 up at the top. And last but not least, don't want to bury the lead for Andrea here. Covered California is keeping us with the same plan designs as always. This is a set benefit structure for all plans. So if you sell in California, you know it. Don't need to bore you guys with the details, but we'll continue to offer all the plan options there with these benefits. All right, broker services. So our broker services team is phenomenal. We Couldn't do what we do without them. And if you're not contracted to sell, please reach out to them, 855-885-3179, number 4 for contracting if you call, or you can reach out via email. Andrea and I can also help you out, of course, but you can, it doesn't hurt to go to the source when it comes to contracting. Same thing for commissions. If you have any recon that is outstanding or any questions about your book of business, they are available there. General questions, you can reach out to number 1, but I do love to highlight our broker care team. This is basically member services for brokers where, they will troubleshoot member related issues, access to care concerns, any, PCP or provider access issues. They are well versed in all that and getting more and more training on, claims and billing and anything that relates to the member experience. They have a fantastic background and they're able to help there. So please don't hesitate to reach out to our BSU. They are in Utah, so 7 a.m. to 6 p.m. Mountain Time, Monday through Friday. And this is our sales team. So we've got my counterpart, Fabian, on the Eastern side. He's available for, all of the states, basically east of the Mississippi. And then I'm on the Western side, focusing on our Western markets, California, Idaho, New Mexico, Texas, Utah, Washington. We did bring on a new resource here, Aldo. He is supporting all of our MSMs with their Spanish outreach. So if you guys have any need for Spanish support, he's available. Of course, Andrea speaks Spanish as well, so a little less need over here in California, but really just trying to build the capacity of the team so that there is no market that is not supported in both at least English and Spanish. And you guys know Andrea here. We also have our Florida contingent, Lindsay Scruggs, who's over kind of North Florida and Mississippi, and Tina, who covers South Florida and South Carolina. She gets all the South there. Amazing team down there. Fabian's also based in Florida. So we got a good Florida crew over here at Molina. And one of the newest additions to our team, Rhonda Clark, she used to run our marketplace broker services team. She is now our Idaho and Utah rep. So you can go to her for, anything contracting or broker services related, but she will be, your contact for Idaho and Utah as well. And Kasai, he covers Kentucky, Michigan, and Ohio. He's based in Ohio. He's been with Molina, I think, almost 30 years now. He's I think, our longest running team member. He was on, community outreach and provider services for a while before we opened up our ACA division. And Kristen, who was, I think, one of the first employees with Molina Marketplace. She was a broker coordinator and now is our marketplace sales manager for Illinois and Wisconsin. She's based in Wisconsin. And the last 3 here on the team, we have my Texas contingent, Jean Wedgeworth, who's out of the DFW area, serving North Texas and New Mexico. And then Gabe out of San Antonio, serving the rest of Texas. So Harris, Houston area, Bexar County, and then the bordering counties with Mexico. Casey up in Washington, holding down the fort for us up there. And I think that's it. So I know we're about 40 minutes here. So if you guys have any questions, happy to answer those. Let me just see here. If we had a Q&A. Can you show Florida again? Yep, happy to. Let me go back. I know we skipped through a lot of stuff. Florida, where are we? You wanted to see silver, I think. Is this the silver plan we were looking at? The silver 9 plan. So similar kind of, deductibles to our silver 1 plan, but with, most of the services available before the deductible. Let's see, did we get everybody? Oh, family glitch. Yep, I can go back to that, not a problem. And feel free, you guys, chat away here if anything comes up. But the family glitch, let me scoot back so I have it here. The family glitch is the term to describe when a employer offers, what is considered affordable coverage to a family, but that is only based on the affordability of the insurance offered to that employee. So a lot of times employers will say, oh yeah, we'll offer, subsidized coverage to, Amy as a Molina employee, but if she has a spouse or children, those folks have to buy insurance at the full cost. There is no, in many cases, Molina might do this, there's not as much assistance for the rest of the family. So, but the way the ACA was written, it considers affordability just based on what is offered to that employee. So those folks, if that what was offered to the employee is less than, I think it's moved up to almost 10% of their annual income, if what is offered to just that one employee is considered affordable by that standard, then the rest of the family has not been eligible for subsidies through the exchange. That is changing this year. Biden made it happen. I mean, they've been trying to get this fixed for years, really since the ACA was written. I think it was kind of realized after the fact that, this doesn't mean just because the employer is offering it to the employee at an affordable rate does not mean that they're offering it to the rest of the family. And so that's why you'll see a lot of families paying, thousands and thousands of dollars for employer sponsored coverage. And it's still considered affordable, even though, the rest of the family doesn't meet that 10% of income guideline, but it does for that employee. So hoping that, we can get the word out. This was kind of late breaking a month or two ago, this got passed. So I know there hasn't been a ton of commotion about it in the market, but if you are enrolling families, and they are or assisting families that are on employer sponsored care that's not affordable for those dependents, this is a great opportunity to get them enrolled on subsidized care for the first time since the ACA rolled out. One more. What regulation fixed the family glitch? That is a good question. Let me go back. I'll have to take that back. I don't know if there was an actual.
I think that was part of the Inflation Reduction Act.
Perfect. Okay. Yep. Sounds about right. All this rolled out about the same time. You are correct.
Okay.
Oh, good call.
Are there any more questions from the gang? And if not, Amy, Andrea, thank you so much for your presentation. It's a lot of information. I'm glad I didn't have to take notes. But as a reminder, we did record the entire presentation. We'll post this. Amy, Andrea, thank you so much. I hope you guys have a really great open enrollment.
Thank you so much, Steve. You as well. Appreciate everyone's time today.
Thank you.
Happy OEP.
Thanks for everybody's participation. Talk to you soon. Enjoy the rest of your day.
Thanks.